What's up, Kansas City? This is your host, Glenn Bryan Frizzell. I have the privilege to be sitting next to community leader, organizer, healthcare executive, Mr. Jim Nunnelley. How are you doing today?
I am fine and equally as honored to be here with you.
Let me first say that I grew up listening to Generation Rap. I remember it coming on in my bedroom Saturday mornings, 1987. I would sit there and listen to that. Radio Scope would come on after that. Then I would turn the television on and watch Teen Summit. I went away to college. When I came back, I heard this voice on air who was giving advice to teens and giving them a word of the week. Now, I would have my college thesaurus there with me, Mr. Nunnelley, but the words that you had, let me say you are a walking thesaurus.
Okay.
You provided inspiration to not only those teenagers who were on the air, but to listeners as well. I want to tell you that.
Thank you.
I hope to find out a little bit more about you today, as our viewers will as well. What's up, Kansas City? We're interested in your commentary. Give us your thoughts, your opinions. If you have any questions at all during this interview, please log on. We respect and we solicit your ideas. Now, Mr. Nunnelley, I understand that you, were you born in Kansas City?
No, I was actually born in Columbia, Missouri, and came here for a period to build the now Rogers Health Center way back in 1969. I was like scheduled to be here for 6 months, and I've been here over 45 years.
45 years, wow. Can you tell us who Mr. Samuel Rogers is?
Dr. Rogers was quite a jolt, if you must, to the healthcare system. He broke away from the usual hospital-based care for most of our people, and he decided that he would set up kind of a little private doctor's office rather than the big hospital emergency room. And it was an experiment at the time, and it was an experiment that took hold, and now there are probably 3,000 such centers across the country. Wow,
I'm going to change directions for a little bit. I found that interesting. You telling us that you grew up in Columbia, Missouri. I'm not too familiar with that many African Americans who are from that area. I know friends who grow up later and go off to college there. Can you talk about your experiences as a boy there in Columbia?
Yeah, obviously I grew up in the very segregated 40s and 50s, and the population there was maybe 1,000 black folks out of maybe a total population of about 20,000 when I was growing up. And then eventually the university spread, and so did the population. I was one of the few people who grew up there and also went to college there. And of course, at the time I went, I was the 22nd African American to graduate from that institution. And so it was a different time, a changing time, but a very indelible time as far as I still live, breathe, think, act in the manner as if I'm still in Columbia, Missouri, a growing up lad and a part of the university. So
wow.
Much of my garb every day is generally with something with Mizzou on it. So that's kind of like what it was like.
Wow. Were your parents influential in your educational upbringing?
Not a lot. My parents were very much working people, and they also worked at the university. For a time, the reason I wear Mizzou garb all the time is because everything I have, everything I know, everything I've been introduced to has somehow or another been centered on the university. My first job was there. Like I say, my parents worked there. I saw my first dentist there. I saw my first doctor there. I mean, it was like the university to me was everything. And that kind of accounts for my genuine long-term interest in young people, because without a little assistance at that almost turning point in your life, that's kind of where it comes from. I felt very alone. I felt very black. I felt very frustrated, but most importantly, I felt very limited, and that accounts for my starting point of dealing with young people even today.
Wow. How did you overcome that? Did you get involved in any particular clubs, activities?
I don't think, no. At the university, I did win a speaking contest there one time, and believe it or not, I got a scholarship to the university because I scored very highly on the achievement test. And as a matter of fact, to give you some perspective, today the ACT is based on a high score of 36, a perfect score of 36. At the time I took it, it was based on a 100, and I made 99 on that test, and therefore was entitled to a full-scale scholarship to the university. And the little part here, which you should know, also drives me, is I had to take the test twice because they couldn't believe that a young black person at a small school, black school that I went to, which was less than 200 in the high school, could beat out over 3,000 other seniors. And but in the end, I ended up with a full scholarship. And one of the little small points you should also understand about my interest in young folks at teenage life, going to college, is I have never paid for a single dime for my college. I don't know what a college loan is. Everywhere I've gone, I've always been able to get a full scholarship. So whatever I do is kind of like debt repayment. I don't consider it a debt. It's more like an experience elongation. And I just want to keep sharing because I was fortunate.
Wow, Mr. Nunnelley, I'm listening to your story there and I'm just awestruck. What's up, Kansas City? We know that this time of year you are graduating. Some of you are graduating, you will be leaving your friends behind. You're participating in commencement exercises. You probably, those of you who've already graduated are in your dorm rooms now, either leaving or preparing to leave. Some of you have jobs. Others of you will be diligently using summer months to search for work. What was your situation like during this time in Columbia? I believe you graduated, I'm not going to say the year, but in the mid-60s. And you're finished with graduation exercises. Do you have a job lined up?
Yes, I did. The university employs over 12,000 people in the town of Columbia. Of course, at that time, that was a large part. It's kind of partitioned out a little bit more now. Maybe it's about 33% or 40% of the jobs. Yes, I went to work for the university, and actually in the dean of the medical school's office. And of course, I just landed right. I say I was lucky, and that was what got me into the healthcare field. And so I was actually the admissions officer for the medical school. I worked myself up pretty quickly, and pretty soon I knew all the doctors who were applying for medical school and those who admitted, and my job was to prepare them paper-wise to be admitted to the school. And that turned out to be quite a political experience, but it also was my introduction into the healthcare field.
You mentioned earlier that you came to Kansas City initially to help start up a phase of the Samuel U. Rogers Health Center.
To build the actual
to
building.
actually construct, to build it, and you ended up staying here 45 years. I have here a citation, and it states that you worked as Chief Executive Administrator at Samuel U. Rogers Health Center. Mr. Nunnelley, you've also served as a family practice administrator at Trinity Lutheran Hospital, surveyor and field consultant for the Joint Commission on the Accreditation of Healthcare Organizations, and you were acting executive director for the Kansas City Housing Authority. If I kept going on and on, you are been involved, your career is multifaceted. Unfortunately, for this segment, we're only going to be able to concentrate, focus in on your healthcare experience. Do you have a couple of stories that you can share? You're at Samuel U. Rogers. Transition us into the life of a healthcare executive, please.
Well, in my opinion, what makes an executive is to be able to hear a concern, but start to solve it almost in the middle of hearing it, and also preparing for a overall solution at some point.
Wow.
So it's kind of a mind splitter. It's not like the professions where there's a clear channel, avenue, focus. The executive has to work on several levels and then engage, or at least rein in, the politics that are associated with that. And then you have a mind that must be able to operate on several levels almost simultaneously. And in that way, that sort of becomes the life of somebody in an executive role. In politics, or even in healthcare, the politics are quite rigid, quite pronounced, but more importantly, necessary, because the physician has most of the healthcare delivery responsibility. However, there are lots of support staff, there are lots of laws, there's lots of finances, there's lots of other people who are intimately engaged in that process. And that makes the executive having to balance not only what's going on at the moment, but also all these different perspectives, which may any given day may be totally different one from the other. And so the life is kind of interesting, and it's never boring, and it's never ending. And you said give you an example. I would give you an example that 70% of our staff at that time were female heads of household. And so you have all the tragedies that go with that, and I say tragedies, the having to go to school to check on children, having to do this, that, whatever. And but I found a way to keep people engaged during the time between November 15th and December the 15th. I made a edict that all of our people would have to work mandatory overtime. Now, you might say, well, why those dates? Well, my first year of being an administrator, I found such a depression after Christmas when people came back, because they had not only spent all their money, but they didn't have money to pay and whatever. So I invoked a rule that you had to work 20 hours a week overtime. And at that time, we would repaint the place, we would clean it up, we would call people up for missed appointments and just kind of get back on track. But the idea was that sensitivity seemed to set me aside from any other administrator, because the people kind of got, and they didn't know kind of what was happening, but they were always felt that they were part of the decision making, and that I worked for them. And if I had to share any part of my success, I always felt I worked for the employees of any institution, not for the board, not for, even though the board hired me, but if I felt like I could amalgamate a force of satisfied, timely, talented work staff, that the rest would take care of itself. And so that's kind of one of the things. And even to this day, I run across people who do remember those kinds of things.
Wow, Mr. Nunnelley, that is very eloquent. Your story there has held up over a mainstream amount of time. How long were you in the healthcare field?
In fact, I still am in the healthcare field. I spent a time with government and substance abuse treatment, which I consider as healthcare. And so I guess I will now do right at 50 years having been in the healthcare system.
Wow, do you encourage young people who come to you to not only aspire to be entertainers, lawyers, communication professionals, but doctors and nurses, healthcare administrators as well?
Yeah, that was part of my role. And remember, I said I have never paid for any of my schooling. I have the most important and the most satisfying part of my life is helping others connect with their dreams and go to school. As a matter of fact, I just got off the phone with a young lady who's at Howard, your university, in the dental school. And interestingly enough, she didn't know that she was going to be in dental school actually until she got there. And
wow.
So it was touch and go all the way, but she, through her perseverance and with a lot of help from the community, was able to get there.
Well, Mr. Jim Grandin Nunnelley, I want to ask you to weigh in on some current healthcare stories, if you wouldn't mind. I listen to your wisdom all the time when you used to appear on the radio. These are some articles that have appeared in the news as of recently. If you can answer the question, that's fine. If not, we'll go on. This first one's from the Kansas City Star, Sunday, May 12, 2013. The universities are trying to halt flow of pills with stricter rules. The misuse of controlled stimulants by college students has created a potential serious health hazard for students not diagnosed with any disorder. Calling these study pills, students are taking them to help with final exams, creating a potentially serious health hazard and the potential for trips to the emergency room. In your opinion, is using these educational study aids, these educational help aids, the equivalent of athletes who use steroids to enhance their sports performance?
Absolutely not. I think that we built into our educational system stress and struggle. I'm not sure if that's the right thing to do, but somehow or another it's made its way. As I was mentioning to you about the young lady at Howard, I mean, you know, there's not only a ACT and a SAT, there's also each profession has its own admitting apparatus, which is another test. And in this test, they say that anything, at this case, anything below 18 is basically unacceptable, and we don't want you, and you can't come here. Well, that begins to set in motion an achievement. However, it's kind of acceptable because you want a person to be in the profession that can always challenge themselves and operate under extreme pressure. Now, having said that, I think there will always be examples of drug use, or at least this, what I call competitive edge drug use, which is different from recreational drug use, which is different from addictive, right? It's competitive edge, where you are trying to get up. The first one that ever came out was something called No-Dose, and this was that coffee is a competitive edge drug. And so consequently, if there's any hope, it's that the competitive edge will be worth it. Now, whether or not the drug or the method to getting there is, we can debate. But my bottom line is, it's always been around, it will always be around, and I don't think anything can change it.
Mr. Rick Montgomery with the Kansas City Star wrote that, and he said they're trying to come up, university administrators are trying to come up with stricter rules to require students to present copies of at least 2 doctor's notes before they can get these drugs.
Mm-hmm. Well, the biggest issue is quite aside from that, is a law that is connected with the American Disabilities Act and with colleges. And what that law basically says, that a person with any disability is entitled to special considerations. Now, generally we think in terms of physical concerns or physical accommodations, like maybe a sloping walkway or handrails or whatever. But this act has been interpreted to actually mean that if a person has an attention deficit disorder, that they are and taking medication for that they are entitled to more time when taking the exam, as well as accommodations for retaking the test if that comes up. Now, this is back to the American Disabilities Act, but where it comes into play with the competitive edge, kids are now claiming attention deficit disorder, trying to get to that as part of their diagnosis so that they can have this extra time to do their work and on tests and whatever. But the real reason is the competitive edge. Can I get that? And I'm saying that to you is that I don't care what regulations, I don't care what law is passed. I don't think we're going to pass enough laws or pass enough regulations to erode away or eliminate this competitive edge drug usage. It'll find its way no matter where it is.
Okay, real quick, I want to cover national news. Julie Pace in the Kansas City Star has written that President Barack Obama is launching a new effort to rally the public around his hotly disputed, she says, healthcare law. Obama will promote the benefits of the law, urging uninsured adult children to sign up for the healthcare insurance exchanges that open this fall. The exchanges are Virtually under this law, all Americans must carry health care insurance starting next year. The exchanges will be established by the states or the federal government. Coverage under the private plans begins January 1st, and nearly 30 million uninsured Americans are eventually expected to take part. Well, he's always going to have opposition to this. Where do you stand in terms of, quickly, because I believe we are running out of time, what's up, Kansas City, but where do you stand in terms of those who do not support President Obama on this? Will they be able to successfully cause problems for him at the state level, in the city level, if they do not cooperate?
Well, first of all, a guideline. There's a long time between when a policy is passed and a time that it's implemented. Okay. Now, to give you some example, just even the Emancipation Proclamation, we're still wrestling with it.
Wow.
What it means or what it does.
Wow, that's
Definitely Brown versus Board of Education more recently in 1954. We're still wrestling with it. Medicare and Medicaid came in 1965. We're still wrestling with it. I'm saying to you,
Voting Rights Act.
Voting Rights
Yeah.
Act,
My mom says it all
1965,
the
yeah,
time.
still wrestling
Still
with it.
wrestling with it.
Because in a democracy, there is always an opportunity for you to speak your piece, speak your mind, change it. And so therefore, it's always up for grabs. When the opposition loses in the policy game, then they will inherently, subsequently, attack the implementation of the policy. And so it's an ongoing frustration. Now that's where strength comes in, but more importantly, that's where dedication to the principles. Where we have failed generally in our race and in our people is that we don't persevere at the implementation level. We generally have too much fun, celebrate the policy, but not be totally prepared to persevere through the implementation. And that is where people are now know that if we're going to be weak in that area. For example, all the people that got out and voted for Obama in 2012 or 2000. Okay, now having said that, the voter rolls went up. However, in the next local elections and next state election, it drops down to sometimes 8 and 10%. If you could keep that momentum that going that we had there, again, the difference between what happens when the policy is passed and what happens when the policy is implemented. It's got to be a continual effort. And all of us, in our own efforts, we should continue to bear the burden of continuing the pressing notion of achievement and change. We should do that. It's a part of us. It's a part of our DNA. It's a part of our element as being part of the African American community. Without that, we become just mirrors or reflection of whatever should not be. And when we learn that, our children, ourselves, there's never a day when we should forget the fact that we were brought into this country as slaves, and we have to fight, and we have to achieve, and we have to change our way out of it. And that's what we must do. That's why, and that's my interest in the young people, never giving them a chance to cry, always setting before them high opportunities and high goals, because you cannot complain your way out of it. You've got to achieve your way out of it.
Continual effort. Wow, Mr. Nunnelley, it has certainly been a pleasure, a learning experience sitting here next to you, listening to you. What's up, Kansas City? We've had the opportunity to speak to community organizer, community leader, Mr. Nunnelley. We talked about his time growing up in Columbia. We talked about his passion and his time connected to the college, how that will be an ongoing issue for him. We also covered his role as a healthcare administrator here in the city of Kansas City. It's been a pleasure. What's up, Kansas City? I leave you with these parting words in the words of a famous Washington, D.C. journalist. Aim high. The sky is the limit. Shoot for the moon. If you miss, at least you'll be among the stars. God bless. Until next time, peace.
Thank you. That was good.
So cheap, come get a seat on True's 62nd Street. Sit back, it's like that, it's laid back, and Mad Jack. I'm going back to
Mad Jack, 6200 Truce. One bite and you're hooked. Open Monday through Saturday, 10 a.m. to 9 p.m. EBT is accepted on fresh fish only. Mad Jack, 6200 Truce, 816-361-6999.